Hey everybody, it's Cheyenne and welcome back to my channel. Today we're doing another dental assisting video. Woohoo! I hope you guys are enjoying these. But today I thought we would just talk about just some procedures and what they actually mean. So probably the question I get the most as a dental assistant is, what is a root canal? A lot of people are a little confused on what actually that procedure is or why you need to get it done. So I have my, I almost fell. I have my handy dandy little model here that I always use. And let's talk about exactly what a root canal, let me get comfortable here, sorry. Okay, let's talk about exactly what a root canal is. Okay, so basically you have your tooth, right? And when you start to get a cavity on your tooth, So let's talk about exactly what a root canal is. Okay, so these are your teeth, we'll just pretend. Okay, so the hardest part of your tooth is actually your enamel, right? Now, we want to place a filling once the cavity breaks through that enamel and gets to the dentin of your tooth. The dentin of a tooth is the soft part of the tooth that's underneath the enamel. So once the cavity gets to that dentin, it's easier for the decay to get to the nerve of your tooth. And that's when people start having sensitivity or teeth start to hurt, is when the cavity breaks through that enamel and it gets to the softer part of the tooth, which is then closer to the nerve, okay? Now, when the cavity gets too big and it has gone through that enamel, it's gone through that dentin, and it has gone into the pulp or the nerve of the tooth, what we call the pulp chamber, that is when people start to get in pain. And that nerve of your tooth is connected to the nerves in your gum tissue, your face. So if bacteria gets into there, that is not good. I mean, that's when people get abscesses or, like gum infections. The bacteria can get to your bloodstream if it's left like that for a long period of time, and you can get sick, things like that. So that is when we need to do a root canal. Now, if a dentist says that you need a root canal, that means that the cavity has gone to the nerve or the pulp chamber of the tooth. So the first thing we will do, of course, is get you numb, but then we drill into the tooth until we reach the pulp chamber, and then we also remove the decay off of the tooth. Now we drill through the tooth into the pulp chamber, and then the doctor will use dental files or endo files to remove the pulp or the nerve of the tooth. And then once he has done that, he will clean out any infection, clean out the nerve. He then will fill it, first with the medication to help soothe it, and then he will fill it with the material that takes place of the nerve. Now, what does this mean? This means that this tooth no longer has a nerve, right? So it has no feeling left in it. So root canals are great because once the cavity gets to the nerve of the tooth, it can be very painful. And basically what we're doing is we're killing the tooth. But even if you leave with the cavity there, you're killing the tooth anyways, but a root canal definitely does kill the tooth because it removes the nerve of the tooth, okay? So great thing with that is you're not gonna have any more pain. You have the root canal done, but now you have no feeling in this tooth. So if you get decay on it again, you're not going to know because you're not gonna have pain on that tooth. There's no feeling left. And even when people get cavities on teeth that have had root canals, when they come in usually to get another cavity on that tooth taken care of or another filling, we usually don't have to get them numb because this tooth has no feeling. So that is what a root canal is and why people need them. Extractions. So some people wanna know, what is the difference? Why can't you get a root canal and like a crown versus an extraction? Now, an extraction is when there's so much decay or a fracture. Sometimes people, fracture their teeth, they break their teeth. The most common things I hear is biting nails, chewing like really hard candies. People, for some reason, like to, a lot of people chew ice, which is terrible. Don't chew ice. But Now, if you need an extraction due to a cavity, that means that the cavity or the decay has taken too much of the tooth structure and there's not enough for us to save. So in order for you to get a root canal done, we need some kind of tooth structure. You can't just have like the root of a tooth. You know, if something's completely broken or there's not enough tooth structure left, that root canal is not going to be successful, and we don't have enough tooth structure to either build you a filling or to put a crown on that tooth. So that is why you might need an extraction. A fracture can happen, you know, if you're biting on ice, or if you bite the wrong way, or you chew something hard, you can fracture, you know, your actual tooth. I've seen people fracture their root like right in half, pretty crazy. And then you would need an extraction. Now, people have a misconception of what an extraction is. They picture like a dentist going there with some pliers and just popping out your tooth, and that's not what it is. We use lots of different tools for extractions, but first we actually luxate the tooth. So we use luxators, and they kind of look like flat head screwdrivers if you want to have something. And I can put some pictures up here too as I'm talking so you can kind of see what I'm talking about. But luxators, and usually a doctor will start with a small luxator. So let's say you're getting this tooth taken out right here, okay? So the dentist, move a little closer. Let's say you're getting this tooth taken out right here. The dentist will put a luxator right here. He'll put it in between this tooth and this tooth, and he will kind of use the screwdriver to kind of loosen up the tooth, right? Because our tooth, we have a root on it, and those roots are in bone, they're in, you know, tissue and ligaments, things like that. So he's trying to loosen up that, or she is trying to loosen up the tooth in that socket. So they will gradually go from a small luxator to a larger luxator so the tooth gets more mobility. And then we do have forceps, which I guess you could say are kind of like pliers, but we're not pulling the tooth. We're really just wiggling it out of that socket. You never actually want to pull the tooth, because then you could fracture the tooth, because again, under the gum line, and I'll try to insert a picture here, there is a root, and we don't want to separate the crown of the tooth from the root, because if we do that, that creates more work for us. We have to go digging after your root, and that's just not fun. They much rather have, you know, this full tooth to remove. So anyways, they use a luxator from small to large to loosen up the tooth, and then they do have a forceps that they will use to grab onto the crown of the tooth. And again, it's like a wiggling motion. It's back and forth, back and forth, back and forth until the ligaments and the bone loosens up in there, and then it comes out, okay? So there's no pulling, there's no tugging, you're completely numb, you're not feeling any of this. The only time they can get a little bit more serious is if you have to do surgical extractions. And a surgical extraction is basically, we have to use a handpiece and a burr to remove bone around the root of the tooth, because the root is either curved or it's, you know, some roots are like this, they kind of curve out and then they go skinny again. So the bone around them makes it harder to remove. Or sometimes too, if the decay is so bad that this crown part is missing, you know, there's something for us to grab onto or help loosen up the root surface. So we will use a burr to remove the bone to make it easier to extract the root. So now that we've talked about root canals and extractions, let's talk about fillings, okay? So a filling. Now, all dental offices are different, but usually if they are small cavities, my dental office does not believe in placing fillings. And I actually really like that. I like working for dentists that are a little bit more modest and they don't need to fix every cavity, because you don't, okay? You can have a cavity on your tooth, and if it's super small and it has not broken through the enamel, which is the hard part of your tooth, there's really no need to fill it at that time, because you can actually stop it from getting larger if you improve your home care, if you floss, if you use fluoride, things like that to help strengthen your enamel and prevent the cavity from getting larger. But once the decay has gotten through the once the decay has gotten through the enamel, the hard part of the tooth, and has entered the dentin, which is soft and is closer to the nerve or the pulp chamber, that is when you have to do a filling. So a filling is, a dentist will use a handpiece and a burr. He will remove the decayed part of the tooth, and then we fill it, okay? Now, there's a lot of concern about amalgam fillings and composite fillings. You know, people don't want metal in their bodies, and that's all up to the patient, whatever they prefer. Of course, on some teeth, there are on some teeth or some circumstances, we do prefer amalgam over composite, tooth colored over metal. But again, it's all up to the patient and what they would like. Now, amalgam fillings are actually not attached to your tooth, okay? Now, this is kind of hard to explain, but they're not actually stuck to your tooth structure. When a doctor prepares a tooth for a silver filling or an amalgam filling, they actually carve out where the filling goes and then carve little, almost like notches into your tooth so that substance can kind of fit in there and expand in there. It's kind of like silly putty in like the container, right? You shove it all in the container and it sits in there nicely. It's kind of what an amalgam filling is. So it's not actually attached or adhered to your tooth. Now, composite fillings are adhered to your tooth. We use an etch and we use an adhesive, and the composite sticks to the tooth, okay? So that's why we use composites for interior teeth, because one, they do show, so you don't want silver fillings, most people don't. But it's also harder because amalgam is not gonna stick to like the facial part of a tooth, okay? They have to prep the teeth differently. Amalgam fillings do last longer. They have proven to last longer than composites. Composites can leak, they fracture, they get staining because they are tooth colored. Someone's honking their horn. But yeah, but it's all up to you and what you prefer to do. Okay, so the next procedure that we do often as dental assistants are crown preps. Now, crown preps are teeth that have lost too much tooth structure for a filling that they now need a crown, or they have gotten a root canal and now need a crown. Now, I say that because once a tooth has gotten a root canal, you do remove the nerve of the tooth. So it does weaken the tooth structure. So a dentist will usually always recommend a crown to go on that tooth to keep that tooth strong. Okay, so a crown prep, what we will do is we will remove any decay that is on the tooth, of course, and then basically the dentist will shave the tooth structure around the tooth until he has enough space that he feels that a crown is going to fit. Because a crown is basically a shell that you put over the tooth structure, okay? So you're going to lose tooth structure because they need to fit a shell over that area. It's kind of like a pistachio shell, you know, like you have the inner part that's a tooth and then you have the shell around it. That's what a crown is. So he will remove the structure off the tooth so a crown will fit over it. During this procedure, he will also take many impressions, because impressions is what he will send off to the lab to fabricate the crown. You usually will leave that day with a temporary crown and then come back a few weeks later to get your permanent crown placed. Now, some dental offices do have CEREC machines, and that is a machine that creates crowns. My personal opinion on those, I don't think they make the best crowns. And that's just my experience. I've seen, as an assistant, I've seen a lot of crowns that have been fractured or break or come off that are CEREC crowns. I think the ones that are made in labs do last longer, but just my opinion. But anyways, but that day you will leave with a temporary crown, and then usually you will come back to get your permanent crown seated. Now, that's a crown prep. So now let's talk about hygiene appointments, okay? So as an EFTA dental assistant, an expanded functions dental assistant, I can clean children's teeth, 12 and under, okay? Now, 12 and under children, they basically get what we call a prophy. Now, a prophy is, we basically will use kind of like an electric toothbrush, and we have a prophy paste that removes staining and plaque, and we will use that, go around all the teeth, floss, remove any plaque, but we are actually not allowed to go below the gum line. We are not allowed to remove tartar or any buildup that is below the gum line. That is when you have to go see a hygienist. Now, a hygienist cleans adults' teeth. They are certified and skilled enough to go below the gum line. And an adult cleaning is just that. The hygienist will use a Cavitron, and it's kind of like a tip or a lot of water pressure, and it goes below the gum line and removes tartar buildup, things like that that has gathered below the gum line, maybe on your root surface, things like that. Now, if you have a lot of buildup, you might need some more deeper cleanings, which you might need to get numb for, which is what we call SRPs, or perio maintenance, things like that, where you have a lot of buildup from plaque or tartar that needs to be removed. And basically all that means is that it's a little bit deeper below the gum line, so you will probably need to get numb for that, because it is painful if someone's digging below, you know, your gum tissue, trying to scrape calculus off your roots, you know, things like that. So you would need to get numb for that. And again, you would need to get numb for that. All right, guys, well, this was the very all right, guys, so I hope you enjoyed this video. This, again, was just kind of like a very basic explanation of procedures. You know, if you have any other suggestions that you would like, please leave some comments down below, and I hope you enjoyed this video, and I will see you in the next one.
More times than I can count. They come running when they hear the sound, yeah.